you. So I'm joined today with Yesenia Arellano. So you're a 2013 PLU grad?
2013, yes.
That's nice. And so recently, during the celebration and observance of National Hispanic Heritage Month, the City of Tacoma also celebrated you and the work that you do as a mental health counselor who provides bilingual therapy to a diverse community and with an immigrant clientele. You yourself having a background in immigrancy and a great story, I'm sure, to tell. So I'd just love to talk to you about that award, that celebration of you and your work, and what that meant to you, and also what Hispanic Heritage Month means to you as well. So let's just start off. If you could tell me a little bit about yourself, your background, and your background all the way up to PLU.
Yeah, sure thing. So I was born in Michoacan, Mexico, and grew up there until about the age of 9. And then my mother and I immigrated to the United States, very much so looking for better opportunities, a better life. And I grew up in Lakewood area, so not too far from PLU. I always knew I wanted to stay close. My community has always been very important throughout high school. I was very involved in community service and really wanted to make an impact because I've had some really great mentors along the way, had a lot of really great support systems growing up. So I wanted to give back. So yeah, I didn't go too far. I started PLU in 2009. I am actually also a recipient of the Act 6 Scholarship, which is a leadership and community-based scholarship. And it was a really great opportunity for me to obviously get a degree and then also be able to come back and give to my community. So I have stayed in Tacoma. Shortly after graduating, I started working for a Tacoma nonprofit called Metropolitan Development Council. They do a lot of really great services ranging from housing, education, employment, and healthcare. So they do have some behavioral health support. I actually started in their education program because I really, during my time at PLU, I did some really good work with the college-bound students. And being a first-generation student myself, I really connected with the young adults and wanted to continue my work there. So I, shortly after graduating, I started working in their education department, allowing or supporting other folks that are going to be first generation, just navigating the whole college enrollment process, which can be really difficult at times. So I did that for a bit as I went back to school. Went to Seattle University for my master's in counseling. They have a huge focus on social justice. So really got into social justice and I'm wanting to help. And as I was doing my master's program, really wanting to hone in like the populations that I wanted to work with. I knew, very early on that I wanted to work with the Hispanics and Latinx community. Part of my background is also I have a psychology degree, but I also have a Hispanic studies degree. And one of my favorite things was getting into those deep conversations around social justice and the history, long history, right? Part of my capstone was on immigration and its representation in the media. I really wanted to work with folks and put my degrees together. So I was like, okay, how can I do this? We have a surprisingly large Hispanic community here in Tacoma. And even just in that program itself, I was one of maybe 3 other individuals identified as Hispanic that were able to provide bilingual therapy services. And very early on into my career, I found there wasn't that many folks that provided therapy services in Spanish. And then just really wanted to provide the support education because there is a lot of stigma, not just in the Hispanic community, but also, in the US, a lot of stigma around receiving mental health services. So I wanted to be that warm presence that can provide a little bit of support, education, and then of course leading them through that process. So I knew I wanted to stay in Tacoma, despite the commute being a little brutal sometimes going up to Seattle, but it was fine. I 3 years done, and I wanted to stick around here. I did some community mental health work through the Comprehensive Life Resources in Tacoma, and then from then on, I joined a private practice that was really looking to support folks in Spanish. So they had a really cool contract with the International Foster Care Program through the Community Catholic Services. and they needed some therapists. So I was like, I love working with teens. I love providing, services in Spanish, and especially for those that are, again, just restarting their lives in a new country where they don't know the language, they don't know the culture, they want someone to talk to. So I really enjoyed my time there. I did that for about 3 years, and just last year, about a little bit over a year ago, I started my own practice, and I maintain a lot of those really great relationships. So I still am serving a large population. I would say about 50-50 of my practice provides services to those in Spanish, and some of those are immigrants, identify as immigrants themselves. So yeah, but outside of that, I mean, I right now I am on leave. I did have a child 3 months ago, so I have a little 3-month-old at
Congratulations.
home. Thank you, who's keeping me quite busy. But I'm really excited to just reintegrate and do some more work in the community. But yeah, I will say I was I was surprised, when they reached out to me. They're like, "Hey, are you busy?" I'm like, "Oh my gosh, that's really sweet." I really appreciate their recognition. I've always been kind of more behind the scenes type of person, but it was very humbling and very great experience to be recognized among other really great individuals in the community. So
Yes. Well, it sounds like you've just kind of hit the ground running the minute you
yeah.
went into college of doing this type of work. And you said you were shocked and honored to be recognized that way. What does it mean to you that they chose you for the type of work you do? I mean, there's
Mhm.
lots of ways that
Yeah.
individuals can help the Hispanic and Latinx communities, but your focus on mental health and wellness. Can you talk a little bit about what that means?
Yeah, I mean, I definitely was, like I said, I was surprised. I am more behind the scenes, but also very excited to hear that this is something that's being recognized and being talked about. I hope that, it is something that continues to be just normalized a little bit more around the type of work, and folks are feeling a little bit more comfortable reaching out, not just the Latinx community, but all types of cultures reaching out. And it just also just emphasized, because it is such a recognition from the city, right? Recognizing that there is a huge emphasis and hopefully more support around bettering the lives of people. So that would be pursuing more resources or advertising more for mental health, physical health type things. Among the recognition, there were a couple other folks that work in community services. I think Lorenzo over at PCAF, right? They're a great organization too that I just don't think it's talked about enough. That does a lot of great work. So it was just really nice to hear that there is, even just a couple minutes during those town hall meetings or those city meetings, that it's talked about the importance of having resources, individuals, and people that they know by name, that they can refer. So it made me happy, right? To know that I'm not the only one that's working towards this, and that there's a lot of beautiful changes that are coming into our community.
Did you always know that this was the kind of work you wanted to do, or where did that moment where you decided that was what you wanted to do?
Yeah, so I knew I wanted to work with people. I've always enjoyed working with individuals. As I said, I had really great mentorships. I saw the fruits of their labor, right? I saw that it was a very rewarding opportunity, and just being able to again do something right for a community that's given so much to you. I did for a while entertain the idea of healthcare, right? PLU has an amazing nursing program, and I consider that. I took plenty of psychology classes, and I just realized, man, I could um, really see myself working in this type of work in this field, being an immigrant myself, having obviously access mental health services myself during college, and in navigating those transitions, I felt a huge calling. So I was like, okay, let's give this a try. Let's see, what it's like and where I can support. Talking to a lot of the professionals that were in this field, kind of asking them like, what drew you to this field? What do you like about it? What do you not like about it? And where do you see a need, really just encouraged me even more. So that was really being close to my professors over at PLU, the ones that were practicing, kind of asking them what drew them to the work. I also had an opportunity going to the career center and kind of asking, like, what do I do? Do I pursue nursing? Do I do, I really like psychology. Do I pursue that? And them saying, you should reach out to Dr. Barton, over at the counseling center, and just even talking to her, it was really inspiring. And I was like, I think I really want to do that type of work. And then also just knowing how versatile it is, right? Because I think having a background in education, like having worked in education for so long, I really enjoyed the teaching aspect of it. And with mental health, it kind of is that, you do a lot of teaching and support and guiding. So I wanted to have that flexibility, as well as the opportunity to work with people in a mental health setting. It can be a private setting, right, or in a hospital setting. So I really like again, the diversity of it and the flexibility, and then just overall hearing that there was such a need, and that other people really enjoyed the work they did.
What's something you think people would be surprised to know about the work that you do, or your patients, or if there's something that is often overlooked or not understood that you'd like people to know?
Yeah, everybody has mental health. I think a lot of the times we have, well, it's getting better, right? But we have this like media representation of people that are broken, or they had really tragic past, or very traumatic, or anything. I mean, there's adjustment, transitions, anybody, we all have mental health. And I always talk about how much we invest in our physical health. We work out, we try to eat healthy, we got to do the mental work too, right? We got to exercise that as well, and help. And I, in my field, I work with a variety of folks. Yes, those that are really needing a lot more support and resources, and those that are very high functioning and professionals and very successful beings. And I try to remind them that, like, and anyone can walk through that door, and it's not as scary, and you're not broken. And some of the most courageous folks that I know are the ones that take that chance and come and talk about those difficult transitions, or identify those vulnerabilities. So I always try to just, again, it's overlooked that, like, anyone right, can need therapy or want therapy. It doesn't have to be this really scary, only those that really need it, type of thing. Anyone. I think everyone has mental health, so we all got to work on it.
Great, thank you. And then why is it important to have observations or celebrations like this one on National Hispanic Heritage Month? Why is it important, do you think, to honor? I mean, Hispanic Heritage Month covers a variety of
Right,
cultures,
right.
all
Mhm.
grouped in. But why? What does that mean to you, and why do you think that's important?
Yeah. I think it really makes people feel noticed, inclusive, right? It's really neat, especially in a country that I mean, there's so many cultures, right? And I hear it, like, it's a month, right? It's like it should be celebrated every day and all the time. But I think it's really neat to hear, again, to be recognized for the work that people are doing, and to also allow people to feel like they're part of this community. It's, again, an opportunity for folks to really celebrate their differences, right, but also their uniqueness. And it's really neat to have, like, these recognitions, because, again, there's a lot of things that folks might be like, oh, that's not for me, or I didn't know that existed, or that was available. So it's really nice to have someone that, like, the community leader, right, to recognize these things and say, hey, it's there, it's important, we should be accessing it. That's what leaders do. They kind of take that first step and recognize things, and tell people, like, encourage people, like, hey, use these services, these are just as important. Yes, we're worrying about budgets for this and that, but it's also important to recognize these other really great resources that make a community wonderful. And then the recognition, again, of just the different cultures, and for folks to feel like, oh, I'm thought of, or I'm part of this community. And this community, when they're making budgets or laws or whatever, they're thinking of me too.
Thanks. Well, thank you so much. I could probably talk to you all day about this stuff. It's so interesting. But thank you so much again for being here and talking.
Absolutely. Thank you for reaching out.